Warning. 10 signs of a weak heart. Heart failure risk. Are you familiar with heart failure or a weak heart? Have you ever wondered if your heart is weak? Do you know the main conditions that can undermine your heart? Could the symptoms you are experiencing be signs of a weak heart? Today, I will talk about the diseases that cause heart failure and the most common signs of a weak heart. Stay with me until the end of this video to understand how to better care for your heart, keep it functioning optimally and prevent the dreaded heart failure. But first, give this video a like and subscribe to the channel. Have you ever had heart problems such as weakness or enlargement? Do you know anyone who is experiencing these conditions? We would love to hear about your experiences in the comments. Also, where are you watching from? We are very interested in learning more about our audience. What is a weak heart? Heart failure. Heart failure is a condition in which the heart does not pump blood efficiently enough to nourish the body. This can happen through three main mechanisms: weakening of the heart muscle, which reduces its pumping force; hardening of the muscle, which prevents the chambers from filling with blood; or enlargement, which reduces the efficiency of the heart's pumping. Heart failure affects 6.2 million Americans, severely limiting their daily activities, reducing their quality of life, generating high medical costs, and reducing their ability to work. After age 70, about 10% of older adults develop some degree of heart failure. The heart is our pump, our vital organ. It is responsible for distributing nutrient-rich blood to all of our organs. When your heart is weakened, it becomes unable to effectively transport oxygen and distribute nutrients to all of the cells in your body. Poor heart function can cause signs and symptoms that are not always easy to recognize. Heart failure is a serious cardiovascular condition that should not be taken seriously. To better understand its severity, consider this comparison: just as a car cannot function properly if its engine is running at half power, when the heart is working at only 50% of its capacity, it becomes extremely difficult to maintain daily activities and a good quality of life. Now let's look at the most common conditions that can weaken your heart. 1. Systemic arterial hypertension (SAH), high blood pressure. SAH is one of the leading causes of death in the United States, responsible for 647,000 deaths per year. To understand its seriousness, consider that the ideal blood pressure should be 120/80 mmHg, or 128/70 mmHg according to newer European guidelines. When someone consistently maintains high blood pressure, such as 160/80 mmHg, 160/80, the heart is under constant strain. This can cause the heart to enlarge and gradually lose strength, leading to heart failure. The most alarming thing is that 45% of Americans with hypertension are unaware of their condition, despite it being the deadliest disease in the world. This is because hypertension often does not show any initial symptoms. By the time symptoms appear, the heart is often already compromised. Early diagnosis and treatment are crucial to prevent the heart from becoming enlarged and weakened. High blood pressure not only affects the heart, but also accelerates the process of atherosclerosis, the buildup of fatty deposits in the arteries. When this process affects the coronary arteries, it can lead to a heart attack. In addition, uncontrolled hypertension can seriously damage the kidneys, which are vital for removing toxins and regulating blood pressure. Therefore, regular blood pressure monitoring is essential for maintaining overall health. 2. Obesity. Imagine a heart designed to support a body weighing 80 kilograms, working in a body weighing 110 kilograms. The result: the heart becomes overloaded, increases in size, and can develop heart failure. Obesity significantly increases the risk of diabetes and hypertension, which are serious health problems. People who are overweight often experience a state of chronic inflammation. Inflamed arteries make it easier for fat to accumulate. They also tend to have higher cholesterol and triglyceride levels, creating a perfect storm for a weakened heart. There are many strategies for losing weight, including exercise and a balanced diet. If you are having trouble, it is always a good idea to seek help from a doctor or dietitian. Modern medications can also help speed up the process and maintain sustainable weight loss. 3. Heart attack myocardial infarction. After a heart attack, the heart muscle tissue is replaced by scar tissue. The result, the heart may become weaker depending on what is affected arteries. Significant muscle loss can greatly increase your risk of developing heart failure. 4. Heart valve disease. Heart valve disease, whether it's insufficiency of the valves that don't close properly or stenosis of the valves that don't open fully, can overwork the heart to the point that it weakens. Even in mild cases, regular monitoring is needed to determine the best time for surgery. This can prevent the heart from weakening due to a compromised valve. 5. Heart palpitations. Does your heart feel like it's racing or beating irregularly? This could be a sign of a weak heart. A weakened heart often works harder to compensate for its decreased efficiency. Rapid heartbeats require immediate medical attention. 6. Diabetes. Do you have diabetes or prediabetes? Diabetes is one of the most harmful conditions for the heart. Here's the key: diabetics should monitor their glycated hemoglobin levels. This test measures the average blood sugar level over 3 months. If the glycated hemoglobin level is above 7%, it indicates poor control. In such cases, consult a cardiologist to evaluate your heart condition and improve diabetes control. Do you know the main symptoms of uncontrolled diabetes? Patients often experience extreme hunger, excessive thirst, frequent and abundant urination, especially at night. Sometimes the urine becomes so sweet that it attracts ants, a surprising way in which some people reveal their condition. Diagnosis is simple, so see a cardiologist for early detection. Why does diabetes weaken the heart? Excess sugar in the blood destroys heart cells, damages the myocardium and provokes inflammation throughout the body. Diabetes accelerates atherosclerosis, which can lead to a heart attack, stroke or heart failure. Uncontrolled diabetes progresses with the same severity as cancer. Self-care and regular monitoring are essential to protect your heart and overall health. 7. Fatigue. Excessive fatigue, especially during everyday activities such as climbing stairs or walking short distances, can be one of the earliest signs of a weak heart. Many people initially mistake it for inactivity or aging, putting off seeking medical attention. This symptom occurs because the weakened heart struggles to pump enough blood to the muscles during physical activity. Exertion, which reduces the supply of oxygen and nutrients. If detected early, the underlying cause of fatigue can be treated, preventing the condition from progressing. 8. Shortness of breath. Breathing. Shortness of breath is one of the characteristic symptoms of heart failure. It usually begins during intense activities such as running or climbing steep hills. As the disease progresses, increasingly lighter activities can cause shortness of breath, which eventually occurs even at rest. This progression occurs because the heart gradually loses the ability to pump blood effectively, leading to congestion in the lungs. Shortness of breath at rest is a critical warning sign that requires immediate medical attention. Also worth mentioning is nocturnal dyspnea, which is sudden attacks of shortness of breath during sleep. This is very alarming, causing the patient to wake up with a feeling of suffocation and an urgent need to sit up. This symptom indicates severe decompensation of heart failure and requires urgent medical attention. Partial relief of symptoms after 20 to 30 minutes of sitting is due to redistribution of fluid in the lungs, but this does not exclude the need for medical attention. Repeated episodes indicate the need for adjustment of treatment and possible hospitalization. 9. Orthopnea. Shortness of breath when lying down. Difficulty breathing when lying down is a common symptom of a weakened heart, caused by fluid accumulation in the lungs. In a horizontal position, this fluid is redistributed, further impairing breathing and forcing the patient to sleep with several pillows or even sitting up. The number of pillows needed for comfortable sleep often increases as the disease progresses, which is an important marker of severity. Patients often report that they gradually need more pillows, starting with one and eventually requiring 3 or more. This progression highlights the deterioration of the condition and the need for medical intervention. 10. Edema swelling. Swelling of the legs, especially around the ankles, that leaves an indentation when pressed, known as pitting edema, indicates that the right side of the heart is not pumping blood effectively. This symptom usually gets worse during the day and improves in the morning after a night's rest. Fluid retention occurs because the weakened heart cannot effectively pump blood returning from the legs, leading to venous congestion. In more severe cases, the swelling can gradually spread to the thighs and even the abdomen, signaling advanced heart failure. How to prevent heart failure? Preventing heart failure involves adopting healthier habits in your daily life, including a balanced diet, regular exercise, maintaining an ideal weight, and regular medical checkups. It is also important to avoid smoking and excessive alcohol consumption. For people with risk factors such as high blood pressure, diabetes, or pre-existing heart disease, it is essential to properly diagnose and treat these problems to prevent undue strain on the heart. Treatment. Heart failure is a condition that cannot be reversed, but there are effective treatments that can help improve quality of life and reduce risks. Your treatment plan will be individualized and may include both medical and surgical options depending on the cause of the problem. Managing the disease means keeping a close eye on things like blood pressure, cholesterol, and diabetes. It is essential to eat a balanced diet, especially with an emphasis on reducing salt intake, as too much can lead to fluid retention and put extra strain on the heart. Regular exercise is also important, but should always be tailored to your capabilities. As for medication, there are different types of medications that perform specific functions. Diuretics help remove excess fluid. Medications like digoxin strengthen the heart's contractions and help regulate its rhythm. Vasodilators make it easier for the heart to pump blood by reducing the resistance in the blood vessels. If there are problems with the heart rhythm, a pacemaker may need to be installed. Anticoagulants help prevent blood clots from forming in the heart, which can lead to problems in other parts of the body. In more severe cases, if standard treatments are not effective, a heart transplant may be considered as a last resort. The success of treatment depends largely on how well the patient follows medical advice and regularly visits their doctor. It is a path that requires dedication from both the medical team and the patient to get the best results. Do you experience any of these signs of a weak heart? Share your thoughts in the comments below. If you found this video helpful, please write yes in the comments below. Thanks for watching.